You make me feel so young. You make me feel so spring has sprung. And every time I see you grin,
From Humphrey Bogart to Shirley Temple to Doris Day, actors in the golden age of Hollywood hold a warm place in our hearts. Audiences even now are captivated by their emotivity and liveliness. But where are they now? Following World War II, there was a massive explosion in population called the baby boom, and these so-called baby boomers and their golden age era parents consist of our current elderly population. Today, this is approximately 46 million people in need of care towards the end of their life. They generally have two options, hospice and nursing homes. These two methods are becoming much more prevalent in today's society. Currently, 9 million Americans are in end-of-life care. The difference between the two involves both age and life expectancy. Almost half of all people who live in nursing homes are over the age of 85 and comprise about 20% of deaths in the United States. The typical reasons for ending up in a nursing home are age and low income. On the contrary, people can receive hospice care at any age, and the majority of its beneficiaries are in it for around 6 months. Nursing homes began as institutions known as almshouses in the 19th century, which were essentially a collection of people unable to take care of themselves, including the blind and the mentally ill, living together. Gradually, the wealthy elderly were taken out of these almshouses to live with those of their own ethnic or religious background, leaving behind them the elderly poor. Then, in 1935, the government barred residents from receiving financial support such as pensions. The almshouses were shut down and replaced with public and private institutions that would take the residents' monthly annuities. From 1960 to 1975, the number of nursing homes increased by 140%, and by 2000, nursing homes had become a $100 billion industry. One thing that many Americans may not know is that people inside of a nursing home are guaranteed certain rights and protections while they are being cared for. From Medicare's website, residents in a Medicare and/or Medicaid certified nursing home are guaranteed to be treated with respect, participate in activities, be free from discrimination, be free from abuse and neglect, be free from restraints, make complaints, and get proper medical care. Other basic services include a room, meals, nursing supervision, medical care when necessary, and social activities. These services make it so that the patients inside of these facilities are able to function and have an almost ordinary day-to-day life. However, there are a staggering amount of reports that show that many nursing homes create environments that are almost hellish for the patient inside of them. ABC News reports that common problems inside of a nursing home include untreated bed sores, inadequate medical care, malnutrition, dehydration, preventable accidents, and inadequate sanitation and hygiene, the report said. There are common problems inside of nursing homes around the country. It also states that there are instances of physical and sexual abuse committed by the staff of the nursing home. According to payingforseniorcare.com, in 2016, the national daily average for nursing home care for a shared room was $225. The least expensive states are located in the southeastern U.S. and Midwest, where the daily cost was closer to $160. The most expensive area of the country, excluding Alaska and Hawaii, is the Northeast, where the daily cost averages are closer to $330. A chart from this same website reports that in North Carolina, the daily rate of a nursing home is $216. That makes an average of $78,840 a year. Now, how can people afford to pay for these services? If you have low income, Medicaid is a state and federal program that provides health coverage. In North Carolina, for aged, blind, or disabled people with a family size of 1, you can't have a monthly income over $1,005. With a family of 2, it's $1,354. That means wiping out any sort of inheritance that one might have for their offspring. And this isn't a small portion of the population. According to the National Council of Aging, over 25 million Americans aged 60 and up are economically insecure, living at or below 250% of the federal poverty level, which is $29,425 per year for a single person. Medicare is another federal program that provides coverage if you are 65 and older. One problem is that Medicare will not usually cover long-term stays in a nursing home, which really isn't viable. My grandmother recently went through all of this and was kind enough to be interviewed over the phone. you think the nursing home's treating him well and everything?
I think so. We always look for signs, and we haven't picked up on any. He keeps trying, looking out the door, and the first couple of days he kept trying to get out. That's why we got thrown out of the one nursing home.
Mm-hmm. Is this one working out better for him?
I think so. We were there last night, and like I say, he seemed very happy there.
Well, that's good.
He had all these women taking care of him.
Oh, no.
He's in a world that I don't know.
Yeah.
I don't know if he understands when we talk among ourselves, whether he can keep up with it and know what we're talking about.
Mm-hmm.
So I just have never been in that world, so I don't know.
One group who is heavily affected by accessibility to insurance is Alzheimer's patients. Alzheimer's has become somewhat of an epidemic as the average age of death rises in America. Though this issue has received relatively little attention, in a few years it will become a commonality. By 2050, the number of Americans aged 65 and older who develop Alzheimer's is predicted to reach 88.5 million people. That's about 3/10 of our current population. This might seem a bit far off, but think about it. By 2050, you might be forced to deal with parents affected by this disease, and trust us, that's a whole lot to deal with. Caring for someone with Alzheimer's disease involves some to all of the responsibility for communication, bathing, dressing, eating, bladder trouble, wandering, and their safety. And at the end of it all, they won't even know who you are. Then you have to deal with the guilt and sadness of sending your loved one into long-term care. Putting your family member in a facility to spend the remainder of their days is no easy task. And it's not cheap either. Did him going to the nursing home create any financial burdens, or did his care just in general create any financial burdens?
Well, going to the nursing home created a very big financial burden, but they've switched him to Medicaid, which is wonderful.
So that's helped quite a bit?
It's helped a whole lot. We couldn't have done it. I looked at the first nursing home I looked at didn't accept Medicaid, and it was $7,000 a month.
Jeez.
And I don't know any old person that would have that kind of money.
I know, because you guys are retired.
Professionals, maybe doctors, lawyers, athletes, movie stars.
I can't imagine.
No, I mean, it's just, in real life, you never make that much money usually.
Oh, no.
And then you're going to be retired and old and sick and put out $7,000 a month. It just blew my mind.
It's a really messed up system, but I'm glad that you got help paying for it. That's really good.
Oh, I am too. I don't know what we would have done. I'm very grateful for Medicaid.
Medicaid was a huge help to those dealing with people diagnosed with Alzheimer's, my grandmother included. In fact, Alzheimer's consumes about 1 in 5 Medicare and Medicaid dollars. What's one thing that you would like people to know about Alzheimer's disease?
What would I like people to know?
Yeah.
That it's very difficult. It's probably easier on the person that has it than the caretaker. And I'm sure they have all kind of reference books and things. And I would say read as much as you can. Because, they revert back to childhood so far that they're even afraid of water.
Yeah.
Like showers scare them, things like that. So you have to be prepared to realize you have toddlers again.
Hospice is a service that provides care for the elderly and terminally ill, either in their homes or in medical facilities. This care normally begins when a patient's doctor makes a formal request or referral if the patient is expected to live for 6 months or less. Hospice staff typically consist of patient's physician, nurses, home health aides, social workers, and/or counselor. They are trained to help care for all types of pain, known as palliative care. Their services include management of pain, assisting with emotional and spiritual problems of dying, providing drugs, equipment, and medical supplies, assisting the family, and providing bereavement care. The idea of hospice care has been around for centuries as people took care of their dying family members within their own homes, but didn't acquire its modern-day definition until the 1960s when Dame Cicely Saunders created St. Christopher's Hospice in the UK. In 1969, the book On Death and Dying was published, which argued in favor of home care as opposed to being institutionalized in a nursing home. Hospices began to pop up across the U.S., but they aren't reimbursed until 1986. Over the next 20 years, many acts are passed regulating the safety and effectiveness of hospices while also improving the quality of patient care, and in 2004, the number of people in hospice service reached 1 million. Each hospice worker is evaluated by state and federal reviewers to ensure that they're capable of the demand from different patients. The problem with hospice care is that it can cost upwards of $10,000 a month, with the Medicare program paying a base rate of $151 per day last year. This means that lower-income households are not able to afford hospice care, even with access to Medicare.
Have you received any help from the government to help pay for Granny's care?
No.
No? None?
No.
None. And is there a reason for that?
Yeah, she still has assets.
Oh, okay. Did you look at nursing homes while in this process, or were you dead set on she needs to stay at the house?
Granny has always said that she did not want to be in a nursing home. And before her husband died, Papa, he asked that we not put her in a nursing home unless it was absolutely last resort.
Were there any compromises that you had to make when looking at different providers and such? What were benefits or disadvantages that you were looking at? Was it just cost, or was it anything
No, her
else?
happiness. She wanted to be in her home.
Is he? Do you think he's happy?
I think he's happy, yeah.
Is there anything else that you would like to say or would like to be included in the documentary?
My only wise saying is that getting old is not for sissies.